Before we continue, I am not trained or certified in any area of mental health or grieving. I am merely, like so many other grieving spouses, seeking coping mechanisms and alternative methods other than prescribed medicines to navigate my own grief journey. The information I'm presenting is merely from my own research and is obviously not a complete method of therapy. I am a firm believer in the ability of our minds to be part of any healing process, and that we do have the power to use our minds in our own life journey. Grief, on the other hand, is one of the most complicated things that I have ever dealt with, and recognizing that we may not be able to heal on our own is one of the most important steps any of us can take while navigating our grief journey. If, after watching today's video, you feel as though cognitive reframing may be beneficial to you, please ask your physician for assistance in finding a wonderful therapist who has been specifically trained in the use of therapeutic tools and who has proven and reputable experience working with grieving spouses. Hello and welcome. Today we're going to look at cognitive reframing as a therapeutic tool for grieving spouses, Part 2. So let's start off with a real quick look back at what we learned in Part 1. We learned what a therapeutic tool is. In the context of counseling or therapy, therapeutic tool refers to a technique, approach, or intervention employed by therapists to support individuals in addressing and managing specific challenges or issues. These tools are designed to facilitate healing, personal growth, and positive change. We learned what cognitive reframing is. It is a therapeutic technique that involves changing the way an individual perceives, interprets, or frames a particular situation or experience. Cognitive reframing may be beneficial for grieving spouses in the following situations. Number 1, guilt and self-blame. Number 2, loss of identity and self-purpose. Number 3, fear and anxiety about the future. Number 4, loneliness and social isolation. Number 5, adjusting to new roles and responsibilities. Number 6, triggering and emotional pain. Number 7, negative self-perception and low self-esteem. As we can see, there are many common emotions experienced by grieving spouses. If we take a look at number 1, guilt and self-blame, we find that cognitive reframing could be useful in identifying irrational thoughts by exploring those thoughts that contribute to these feelings. Thoughts like, I should have done something differently, or it's all my fault. For grieving spouses dealing with guilt and self-blame, cognitive reframing could be useful in helping them identify and challenge cognitive distortions, thinking errors, that are contributing to their feelings of guilt and self-blame. Common cognitive distortions include overgeneralization, or making sweeping conclusions based on limited evidence; personalization, assuming responsibility for things beyond one's control; mind reading, assuming what others are thinking without evidence. By using cognitive reframing, grieving spouses can gain a more balanced and realistic perspective by recognizing and challenging these distortions. Many grieving spouses experience guilt and self-blame. Cognitive reframing could be useful in helping them reframe those thoughts and then cultivate self-compassion. Cognitive reframing involves replacing those irrational and self-blaming thoughts with ones that are more compassionate and are more balanced. Cognitive reframing can help reframe those self-blaming thoughts by considering factors beyond one's control, by acknowledging that mistakes happen, and by understanding that grief is a complex process that does not solely rest on one's actions or choices. By working with a therapist, grieving spouses can develop self-compassion and an understanding that it is natural and normal to experience guilt, but that they do deserve understanding and forgiveness from themselves. Grieving spouses may find cognitive reframing to be useful to help them focus on lessons learned and their personal growth. Cognitive reframing can help grieving spouses shift their focus from self-blame to personal growth and any lessons learned. By exploring the experiences and challenges faced during the grief process, grieving spouses can identify valuable insights, identify resilience, and identify personal growth. By exploring the experiences and challenges faced in the grief journey with a therapist, cognitive reframing can encourage a more positive, forward-looking perspective. In looking at common emotions experienced by grieving spouses, we've just touched upon the guilt and self-blame. We've looked at identifying irrational thoughts, examining evidence and alternative explanations. We've looked at challenging cognitive distortions, reframing thoughts and cultivating self-compassion, and focusing on lessons learned and identifying personal growth. Through these techniques, therapists can help grieving spouses challenge their guilt and self-blame, develop self-compassion, and construct a more realistic and compassionate understanding of their role in their loss. This process can help support healing, acceptance, and moving forward while still cherishing the memory of their loved one. Now that we've covered the first common emotion experienced by many grieving spouses, I have an exercise for you. For further exploration, these questions are meant to encourage self-reflection and introspections. Please feel free to explore these at your own pace and in a manner that feels comfortable to you. Journaling can provide a safe space for expressing thoughts and emotions, gain insights, and promote healing throughout the grieving process. Question number 1. What specific thoughts or beliefs contribute to my feelings of guilt and blame regarding my spouse's death? Question number 2. How realistic and accurate are these thoughts and beliefs? Are there any cognitive distortions or biases present? Question number 3. What evidence exists that challenges or contradicts my feelings of guilt and blame? Are there alternative explanations or factors beyond my control to consider? Question number 4. How would I view the situation if I were an objective observer? What would someone who cares about me say about my level of responsibility? Question number 5. How have my feelings of guilt and blame affected my overall well-being and my ability to heal from my loss? Question number 6. What aspects of the situation were genuinely within my control? How can I differentiate between the two? Question number 7. How might my spouse view or understand my feelings of guilt and blame? Would they want me to carry this burden? Question number 8. What lessons have I learned from the experience? How can I apply these lessons to grow and move forward in a more positive way? Question number 9. What steps can I take to cultivate self-compassion and forgiveness towards myself? How can I practice self-care and nurture my own healing? Question number 10. How can I reframe my thoughts about the circumstances surrounding my loss to create a more balanced and compassionate narrative for myself? Question number 11. What are some alternative ways to interpret my actions, decisions, or circumstances that do not involve excessive guilt or blame? And question number 12. How can I honor my late spouse's memory and legacy while releasing myself from unnecessary guilt and blame? Please remember, you can explore these questions at your own pace and always do so in a manner that feels comfortable to you. Okay, let's move on to the second common emotion. Another common challenge experienced by many grieving spouses is the feeling of loss of identity and self-purpose. When we lose our loved one, it can cause us to have a sense of disorientation, confusion, and a loss of direction in life. Cognitive reframing could help grieving spouses navigate this struggle. Cognitive reframing can help by beginning the exploration of the concept of identity and the recognition that our identities are multifaceted and they evolve over time. By assisting grieving spouses in exploring their sense of self beyond their roles as a spouse, therapists can encourage consideration of other identity aspects such as values, interests, strengths, and personal goals. Cognitive reframing can help grieving spouses reframe the narrative of self. Narrative of self basically refers to the internal story or narrative that we've constructed about who we are, our life experiences, our beliefs, our values, and our sense of identity. Cognitive reframing begins challenging and reframing those negative or limiting beliefs about our identity. By assisting grieving spouses examine and reframe thoughts such as, I am nothing without my partner, or I have lost my purpose in life, therapists can help those grieving spouses begin to recognize their own worth, potential for growth, and their ability to redefine their narrative of self. Cognitive reframing could help grieving spouses in rediscovering personal passions and interests. Cognitive reframing encourages grieving spouses to explore and reconnect with personal passions and interests that may have been overshadowed by their role as a spouse. Through reframing the perspective, grieving spouses can begin to view this life chapter as an opportunity to rediscover and nurture their own unique interests and passions, a reclaiming of their sense of personal identity. Another thing that many grieving spouses can struggle with is setting new goals and aspirations. Cognitive reframing could help grieving spouses set new goals and aspirations for themselves. By reframing their thoughts, it allows grieving spouses to see the future as a time and opportunity for personal growth and exploration. Working with a therapist's support, grieving spouses can identify and pursue meaningful goals that align with their values, giving them a sense of purpose and fulfillment to their lives. Grieving spouses can sometimes struggle with the recognition of their own personal strengths and resilience. Cognitive reframing can help to acknowledge and reframe thoughts that undermine one's self-perception. Working with therapists, grieving spouses can learn to identify their personal strengths, qualities, and past instances of resilience. Cognitive reframing those thoughts allows grieving spouses to focus on the positive aspects, rebuild their self-confidence, and see that they are capable of adapting to life's changes. Grieving spouses can struggle with embracing new roles and possibilities. Cognitive reframing can help grieving spouses to embrace new roles and possibilities that emerge following the loss of a spouse. By reframing perspective, grieving spouses can view these opportunities as chances for growth and reinvention. Therapists can support grieving spouses in exploring potential roles in their personal lives, relationships, careers, and communities. Working with a qualified therapist using cognitive reframing can help encourage a mindset that welcomes and adapts to change. By looking at how cognitive reframing may be beneficial to grieving spouses who are struggling with a loss of identity and self-purpose, we've taken a quick look at exploring the concept of identity, reframing the narrative of self, rediscovering personal passions and interests, setting new goals and aspirations, recognizing personal strengths and resilience, and embracing new roles and possibilities. Through the process of cognitive reframing, grieving spouses can learn to reframe their thoughts and begin nurturing their sense of self and finding a renewed sense of identity and purpose as they navigate life after their loss. This journey of self-discovery allows us to still honor our late spouse's memory while embracing our own individual path forward. As we complete our look at cognitive reframing and how it could be beneficial to grieving spouses struggling with the idea and concept of loss of identity and self-purpose, I have put together a list of questions for further exploration. These questions are meant to encourage self-reflection and introspection. Please feel free to explore these at your own pace and in a manner that feels comfortable to you. Journaling can provide a safe space for expressing thoughts and emotions, gain insights, and promote healing throughout the grieving process. Question number 1. How has the loss of my spouse impacted my sense of identity? In what ways do I feel that my identity has changed or shifted since the loss? Question number 2. What aspects of my identity were closely tied to my role as a spouse? How can I explore and embrace other aspects of my identity that may have been overshadowed? Question number 3. What are some personal passions, interests, or hobbies that I have neglected or set aside? How can I reconnect with these activities and integrate them back into my life? Question number 4. What values and beliefs are important to me as an individual? How can I honor and express these values in my daily life? Question number 5. What are some strengths and qualities that I possess as an individual? How can I draw upon these strengths to navigate my life now? Question number 6. What are some new roles or responsibilities that have emerged in my life since the loss of a spouse? How can I approach these roles with a sense of purpose and adaptability? Question number 7. How can I reframe my perception of the future to see it as an opportunity for personal growth, reinvention, and finding new sources of purpose? Question number 8. What are some goals or aspirations that I can set for myself? How can I work towards these goals to create a sense of direction and fulfillment? Question number 9. How can I practice self-compassion and self-care during this period of transition and rediscovery? What activities or practices nourish my emotional well-being? Number 10. What are some ways that I can honor the memory of my spouse while also embracing my own individual journey? How can I create a meaningful and balanced narrative that incorporates both elements? Question number 11. How have I demonstrated resilience and adaptability in the face of this loss? What can I learn from these experiences to further shape my sense of self-purpose? Question number 12. What are some small steps that I can take today to reconnect with my sense of identity and discover new avenues for self-expression and personal growth? Please remember that if you can't do these questions and journaling today, at this point in your grief journey, it's perfectly understandable and it's perfectly normal. They'll always be here for whenever you are ready. Thank you so much for joining me today for Cognitive Reframing Part 2. I look forward to you joining me in Part 3, where we'll continue taking a deeper look into cognitive reframing. Don't forget to like, subscribe, and hit that notification bell so that you'll know when Part 3 is available. If, after watching today's video, you feel as though cognitive reframing may be beneficial to you in your grief journey, please ask your physician for assistance in finding a wonderful therapist who has been specifically trained in the use of therapeutic tools for grieving spouses and who has proven and reputable experience working with grieving spouses. Until the next time, wishing you love, light, and hope. I've been Sissy, and I hope to see you soon.